Hey everybody, welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor, brought to you by his book, America on Steroids, A Time to Heal. You can get that at his website, anabolicdoc.com, his other website, metabolicdoc.com, or amazon.com, where you can buy just about everything, probably even a kidney if you needed it. Now, you were missed in Las Vegas, doctor. You really
Oh
were.
boy.
Yeah.
How was it?
It was great. You know, you couldn't have kept up with Dr. Tuliados anyway. That guy was everywhere.
He was everywhere.
He really was.
He got everyone signed. He,
He,
he had guys holding the book.
he ran up on stage after Brandon Curry won the Mr. Olympia. I'm not making this up. With his book, gave him a book, and signed it for him before security could tackle him.
Holy moly.
I'm not even making that up. That's, yeah, he had a great time. It was cool meeting him in person. He's a good guy, really cool guy.
Guy's a good PR guy, better than me.
Yeah, he was working it. He was working it. But, you know, he's hoping you're going to make it to the Arnold. I hope you make it to the Arnold. Yeah.
Try the Arnold's definitely the biggest one, right? That's that's big. That's just craziness.
Yeah, I mean the expo, the Arnold Expo is a lot bigger, and there's a lot more people. The Olympia is a more prestigious event per se, but you know the Arnold's no joke either. You got about 100,000 people in town, Columbus for that.
Oh.
So you're in Fort Lauderdale, Florida, right now.
Yes. Down here. Yeah. Woo! Loving it down here.
Business. I wanted to tackle a video. You just did a video last week that really caught my attention because it's so basic that I realize how remiss I've been with all these videos we do, that we need to get back to some basics. So your video was called Considering Using Steroids, Understanding Your Risks. Because, you know, all the time, it seems like I'm pro-steroid because all I ever do is talk about how great they are and they like being jacked and we look strong and this and that. But, you know, I'm not pro-steroids, I'm not anti-steroids. And I think it's only the responsible thing to do to talk about the risks that do come along with taking steroids, because contrary to what a lot of these young guys, the Boston Lloyd fans, sorry, Boston, your fans, all believe they're completely harmless. You could take them as many steroids as you want for as long as you want. Nothing bad will ever happen to you.
It's some kind of a conspiracy theory, right?
No, I mean, yeah, they think that we're trying to scare them away from steroids so that they can't get big and buff, you know, that we're just haters and we don't want anyone to get big and strong.
Is Boston Lloyd still out there? I've lost track of him. He's still out there though. It's kind of been quiet. No,
he's been quiet. He's got a son now. I think he's mellowed out.
Awesome.
Yeah, you know, I think he doesn't want to do anything that could potentially get him in trouble, such as like advocating massive steroid abuse on videos or injecting steroids on videos or things like that.
Smart guy.
So your video basically, doctor, was something you probably have done in your own office with patients. I don't know, hundreds, thousands of times.
I just kind of put the video. I mean, I prepared it, but I just put the camera on, and my guys just edited a little bit of it digitally, and I wanted that video to get out because that's just what it is, guys. And again, I was very like, look, that there's data we know, and there's things we don't know. It's not a scare video, but here's what you're going to look at.
Yeah. So this is me. I'm a guy walking into your office. I probably wouldn't be as old as I am. I'd be a younger guy maybe. But and I'm thinking about using steroids, and you're going to sit me down, and you know, I'll go through you outline them point by point. So I'll just go through your points, and you tell me a little bit about. So
awesome.
You started off with short-term effects. These are things that are not. If you stop steroids, if you cease the use, some of these are going to be reversible.
Yes.
So the first thing, guys are concerned with appearance, your hair. You might lose your hair. Yeah, I mean,
don't you agree with me, Ron? Don't you agree with me on that?
I mean, I've been fortunate, but I know a ton of guys. I mean, you know, most white guys don't look good with the cue ball look, and I see a lot of them walking around the Olympia and the Arnold, just, you know, no hair, it's gone.
Hey, so men lose hair anyway, but if you're prone to it, you're right. If you get some steroids, and even depending on what type of steroid, we could talk for 10 hours on the NOR19 drugs, the estrogenic drugs, and or the nandrolone drugs and the testosterone derived and all these drugs. You do tren. I mean, your hair is gonna. I mean, like.
So where does it? What is it like? Male pattern? Does it typically recede from here, or is it that male pattern baldness?
Here's the deal, and you and I are. My hair is kind of thin here, but it's. I've been on testosterone for 20 years, and my hair just thinned out a little. If you look at my brother, his hair is thicker than mine, so there's kind of like a twin study.
Okay.
So basically, it's very interesting. So male pattern balding starts up in the corner up here, and then it also involves also the whole center. It's the guy that has the little curl, has the wheel hubs, and his hair comes off. I mean, though, you see guys coming out of high school and they start losing hair. That's just genetic, bro. And like a lot of guys, I just say that's just genetic, sir. Like and everyone loves to look at the gene. Like my grandmother, my mother's grandmother's father's sister's uncle's best friend
Yeah.
had this kind. Look, men are men. We're going to lose our. I mean, most 80-year-old men don't have incredible thick hair. But what's amazing? You ever see some of those guys, like you'll be out somewhere and you go, look at that guy's white, thick hair.
Yeah.
And just
Yeah.
that's just the best. He has no DHT. It's DHT.
Mhm.
There's no, again, I'm not a plastic hair surgeon, plastic surgeon, dermatology guru, hair guy.
Right.
So, but what I understand is it's dihydrotestosterone is converted from androgen, and in the follicles there is a susceptibility to it. And when there's too much, when it's just that ratio and those genes and that stimulation's linked up, those follicles they die,
Yeah.
and then it loses the hair, and the hair come up. There's so many other combination. There's so many other, I guess, relative forces. All that hair shampoo you can get to try to hold on to your hair. There are some other, dermatologic and irritation and skin's dermatologic sensitivities to it, but you're either going to lose it or not. And if you take more androgen and
Mhm.
more androgenic androgens, I
Yeah.
mean, you're a common sense guy. You're going to God, how many guys have I helped and just said, if you guys come in, they go, I want to be on tier T or I just started tier T. They come in the office. And I'm like, and I go from head to toe and they go, Doc, is that true about the hair loss? What can you do about it? Um, Please don't take finasteride.
Ooh.
And I want to tell right now, finasteride syndrome, this week alone, at least two guys. I mean, this week we're getting hammered. It's
Mm.
like 10 guys coming in, two guys, maybe four guys directly coming in because of what finasteride is. These are regular. Half my guys are steroid users. The other half are just regular executives that are on TRT, or they just want to be evaluated.
Yeah.
So we have a lot of fans, Ron, that they're not steroid users. They just like to watch me and you talk, and it's just really cool stuff, man. So and they're interested, like they're always interested. Maybe I'll do it. Maybe I'll take the plunge. So finasteride, please, everyone, be very careful with finasteride because it's used for men that are not on testosterone, propecia, and it's a DHT blocker. It does save the hair, but
But
man, I swear to God, you guys, I swear, there's a whole nonprofit organization, finasteride syndrome. I am not kidding, Ron.
what is it? I don't know what finasteride syndrome is. What does it affect?
Oh, so men that use when you look this up on when you guys out there, when you look this up on Google, your head's gonna roll. It's so big. I don't know if it's that overblown. It's true that some men are sensitive to it. When you block DHT with this, just for your hair,
Right.
and what can happen, it's not everyone. Maybe it's 1%, 5%, 10%. Maybe some guys get a little and some guys come off. You get erectile dysfunction, poor libido, depression. We're done, Ron.
Forget it. What's
Ron.
good? What good is having your hair?
So, so steroid users, so many guys come in and I go, okay, are you ready? Let's talk about testosterone replacement side effects because it's what we're talking about, right?
Right.
Steroids just puts it on accelerated, I guess. No one really knows. So hair loss. I mean, I've had guys in the last 6 months, a couple, small number. Most guys come in, they're already on stuff and they already made decisions and they're trying to get some help from health issues. And the guy goes, Doc, I'm going to stand up right now and shake your hand, just say I met you. Please sign the book for me because you're telling me that this is going to affect. Done. Game over. Finished. Out. Signing out. Sayonara.
Fair enough.
Ron,
Next one.
can you believe it?
I'm ripping right through this. Acne. You're going to get backne
Acne.
all over your back. It's disgusting.
So more genetics, I don't get acne. Oh, good luck. I have guys that just do a little androgel, poof. So genetics. And I say this, if you look back how you were pretty much in puberty, aha, like you're going to bring that back, and then it could get even more so. I mean, isn't it true though? It's like some of those top most of the top professional guys, look at their skins. They're beautiful.
Yeah,
They don't get
there's not one zit, never.
beautiful. I mean, these are just lucky. They're selected. It's Darwinism on the stage there. They're selected because they tolerate what they do. They're great genetics. They can take some drugs. We all know they don't take all that much, but they take drugs.
Really.
Some guys take not more than others, but so acne, you're gonna take androgens, and we could talk until we're blue in the face. Doc, I blocked the estrogen with aromatase inhibitors for my acne. Oh my God, it can help a little. So acne vulgaris is that sebation that builds up in different genetics and different people. Women certainly get it. They're not on steroids and testosterone. At least that 13-year-old woman you met at McDonald's giving you your cheeseburger, and you look at her face and you go, oh, you poor thing, go see a dermatologist. So she's on estrogen right now and she's getting it. So it's androgen, estrogen, genetics. Next point.
Okay, gynecomastia.
Gyno,
Yikes. Oof.
gyno, bitch tits.
Ugly.
And that's again, some guys, you just give them a little androgel,
Yeah.
poof, bitch tits. Other guys, look at some of these guys. They do a gram of gear. No, look at you.
I've done a gram of gear many, many times. Not one thing's ever happened to my nipple.
No,
and no anti-estrogens.
That's a mouth bouncer. That's a mouth bouncer. There are guys that watch these videos and they go, Doc, is that true? Because I have guys that are on baby doses. No, it's not for babies. Baby doses of testosterone, Ron, 0.25, 0.1 every other day. And Doc, I have right here, I got this little gyno. I really hate it. So I got to go see the surgeon now. I'm not doing those AIs anymore because you're right. I don't want to have a heart attack. It destroys and disseminates my HDL, and I don't feel good on those AIs, Doc. So that's kind of over with that stuff. AIs, I'm predicting you're dead. Some men still use them because they're not good, and they don't. There's a way to get around them if you could dose around AIs. I do it all the time with it's
smaller doses. The micro doses every couple days.
I'm telling you, I got it all figured out. Why would you take them? Most men, and I back this up with my research now, don't feel well on aromatase inhibitors. Maybe they do for a few weeks or months. It wears off. They feel horrible.
They tank your good cholesterol, the HDL, right?
No, that's guaranteed for everyone.
Mm.
Why would you want to take a risk? But anyway, a lot of young guys don't care
trying
about
to get jacked.
A lot of young guys don't care. So yeah, gynecomastia. You know what's one interesting point? In the beginning, when I did this over 10 years ago, I thought, shit, we're going to see super physiologic estrogen levels. Therefore, we're going to see breast cancer. Knocking on wood, I've never seen one case of breast cancer. It doesn't mean it's not out there, but you don't see. So the androgen levels from the ester somehow, and I've talked recently with some oncology guys about this over in Europe. The overload of the androgen protects somehow despite super physiologic estrogen. If you gave just estrogen to women, they have an increased breast cancer risk.
Wow. Cool.
But not with men. So it's interesting. We don't see breast cancer, although if you have a nipple that's bleeding or a lump or something, how many guys are going to get worked up? The doctor's got to they have to do a breast biopsy, right? Or they have to do mammograms. Did you know that, Ron? They do mammograms.
Never heard of a man getting a mammogram, but
many all time.
Boy. Okay, so another short-term effect is edema, water retention.
Boom.
We call it the moon face, especially D-ball and Anadrol, notorious.
Yeah.
I had to stop. I love the Anadrol, I love D-ball, but I can't use them because my face, I don't have the slimmest face as it is. I don't have those model cheekbones. And on D-ball or Anadrol, all I hear, especially when I make these videos, is all the comments of, ha ha ha, lay off the D-ball, Harris, lay off the Anadrol.
I love it. Come on, we love this stuff.
So most steroids will do this, but there are some that do not cause water retention.
No,
right?
Well, Ron, you know it better than me. The estrogenic steroids versus non-estrogenic steroids, like Tren.
Yeah.
I mean, but then how many guys are using the drug by itself? They're using them all together. This would be a great question for Dr. T. I mean, because it's just like, but estrogenic steroids, testosterone is the base. So everyone's on it. I get it too. I get a little, just a natural, it depends on what you got to starve yourself and not eat anything. Or everyone's gonna, some guys are living on Lasix, which is just, you're gonna destroy your kidney on Lasix. I've seen last month I saw a guy who, one of the particular one reasons why he destroyed his kidney, genetics, well, three: genetics, hypertension, steroids, just bad luck, and then he's definitely living on Lasix, which is just interesting. He's not a pro bodybuilder, just a regular businessman, and he got addicted to, and he just loves it. So he's, Lasix, man, I would just take the bloat off. He was using up to like 40 milligrams of Lasix a day. We use that for like that's a pretty good dose for someone who has heart failure maintenance. For heart failure maintenance.
I can't believe he's alive, this guy.
The body takes a lot, Ron. The young body could take a beating.
Apparently. So we also have issues you're going to have with your liver. Your liver values are going to be very skewed. Those enzymes, anytime you get blood work done and you're on a cycle, my doctors always freak the F out. Tell me I have hepatitis or something.
I saw a guy today that has his total bilirubin is even elevated. Haven't seen that for a few, I don't know, maybe 6 months.
Oh.
I mean, bilirubin is elevated. Transaminases are always going to be elevated, and we don't even know if that's muscle spillover or if that's a little bit of NASH or non-alcoholic steatohepatitis or NFELD, which is non-alcoholic fatty liver disease, or it's muscle spillover. It's coming from skeletal muscle, and the machine is reading it erroneously because it's really not coming from the liver. So, but liver enzymes on oral steroids, though, Ron, it is true. It's, there are some idioms that are really kind of tried and true. Dr. T would love this show, because the transaminases will go up on even 10 milligrams or so a day of Anavar in some guys.
Wow.
And Anadrol, all the orals. So, but it's not like the truth of the matter is, I'm not saying it's a light matter, but if you stop them, they go back down. But like, again, the guy today, he's lost a lot of weight. This guy's been using on and off oral steroids. Came in with his wife this morning to see me down here in Florida. I have to send him now. He's trusting me. I have to send him to a liver expert. This guy could have a liver tumor in there right now.
Wow. Ugh,
it's rare. It's rare. It's rare. I've seen guys. It's rare. So, and I saw another guy that had just an upper limit normal and that's Gil Braze, and he probably will be fine. So there's two guys in one day, in 2 days, where I've seen one may have liver something, one guy is not, but like, we don't know the upper limit normals on some stuff. Anyway, it's so complicated.
Prostate. What happens to your prostate short term on steroids?
Prostatitis. Guys will have, remember Dianabol story?
No.
So remember Ziegler? Dr. Ziegler made Dianabol because he saw all the rot. Come on, Ron, you know your history.
No, you just talked about this in a show like a month or two ago.
So Ziegler, this is the truth, and I could shoot holes in the truth, because most men don't have prostate symptoms on steroids. If they did, we wouldn't have this huge epidemic.
Yeah.
Because they would feel like shit, and they'd be pissing, they'd be frozen up. So men that are on androgens, classically, testosterone esters and alkaloids and the old-fashioned Winstrol, Anavar, all the usual goodies. So it doesn't do anything to most of these guys in the beginning. They're still pissing like racehorses. There are men that have genetics for the pelvic pain syndrome. They have genetics for early prostatitis and BPH.
Benign prostate hypertrophy.
You got it. Now you're getting up to the age, buddy. Welcome to the age of 50, so on and so forth. So, how's your prostate, Ron? If you're a very old guy.
I still urinate quite freely, thank God. I mean, I can't imagine how frustrating it would be to sit there trying to pee and not enough is coming out. And I think if you have it in an advanced case, you always feel like you have to urinate.
Ron, these guys have this. These guys, it's such a nuisance and it's so scary and irritated. Now, are they nervous nowies, or now are they neurotic and anxious and anxiety ridden? Because I've had some of these symptoms, and let me tell you, it's annoying. It's a nuisance. You're 40 or 50 or even 35, and you're pissing like you're an 80-year-old man every corner. Stop the car, I have to go piss. And is that I'm drinking too much water or caffeine? I mean, come on, guys. Your prostate is affected by these anabolic agents. Who's going to argue me? There's no one could argue me. It's gambling in Vegas. Now, you stay on these things long enough, you're entering the age in the 40s to 50s, even TRT, it's going to affect most guys' prostate. Now, it doesn't cause prostate cancer. But we got to watch. Could you have if you have prostate cancer and you start steroids or testosterone at the age of in your 50s or older, which guys do?
Yeah.
I see new guys coming in, mid-age crisis guys, 45 to 70, and they're just found steroids, and now they're like, I end up in the ER, doc, because I couldn't piss because I got obstructed. Ron, I see it. It does happen. It does happen.
Moving on, sex and fertility side effects.
Short-term side effects, short-term.
Awesome sex. No?
Awesome sex. 99% of men, awesome sex. I tell you, we're not the brightest bulbs in the tree. If you just give steroids to our brain, we're hypersexual beasts. You agree with that.
Oh, yeah, absolutely.
It's like people watch some of the shows, they go, I didn't know any of this. Where you been? Sleeping?
Yeah, where you been, guy? Come on.
Sleeping under a rock? But so some men, now we talk about the man per man stuff, the fingerprint stuff, which I love taking care of men personally. Each man, it's never boring because it's a different man. Guys will tell me the different, I used to be this, doc, and this, and now this is, but guys have depression. They have anxiety, not to mention the prostate issues, heart. There's so many moving parts. Sex, when you take steroids, most men will have a wellness in this high sex drive. It can destroy your life because if you're cheating on your wife and you're making we're not the brightest bulbs in the tree. That's like certain levels of tiered out. We can make bad decisions, Ron.
Absolutely.
Ron, you're laughing because if your honey, then she comes in, she's like, "Who you texting, Ron?" Now,
how did you know? How'd you know? Oh, no.
You're looking around the corner. Now, I see you in the Instagram holding on to those honeys. I'm like, oh my God, Ron.
Yeah, it can lead to a lot of trouble. Absolutely.
You're a celebrity. You're Ron Harris. You're allowed to do that. But
I'm just doing my job. That's all I'm doing. So.
But guys get hypersexual. Who wants to lose that?
Yeah.
So when you get on testosterone, you have to stay on testosterone. That's really my main business, because now that you've been on and off, and you did your PCT, and now you come to me because you're like, oh, doc, I got a blast and I can't get off it. Why? One reason only. They don't give a shit about the hair, the tits, the heart, the balls, the prostate. One reason only.
The penis.
Am I talking the truth, Ron, or is this the
base? Absolutely. We are not the brightest bulbs. You're right.
Come on, Ron.
You say it all the time. And fertility, obviously, if you're on a cycle, you're probably not going to be able to get your wife or girlfriend pregnant.
Let's make it interesting. Yeah. So back in the day, in the 60s, 70s, and 80s, even today, the poor man's fertility drug is a shot, 200 or 400 of Cypionate in the ass.
Wow.
Because when you go on and off steroids, I got fertile, I'm on off. Okay, fella. When you give testosterone and anabolic steroids to a young fertile man, your sperm count, you're all over the place.
Yeah.
So that's why these men, very young, I mean, they have kids, because you can't shut this thing down that easy. Right. It takes time so the acute effects, they're not infertile.
Okay.
But after you stay, no one knows. I mean, you talk to fertility experts. After, how long does it take to suppress the semen? They'll have an answer for you. About a month. About 2 weeks to a month, you're starting to kind of dive down the other way. But when you're shifting everything around, going on and off cycles, your sperm count's going up and down, and you just need one. So guys, but sooner or later, that's more of a chronic.
Okay, so we'll get to that. We'll get to that.
Yeah.
Withdrawal is obviously, you put CNS and withdrawal in the same category.
It's CNS. It is. And that's what I've discovered in the world, right? Anabolic steroid-induced hypogonadism. It's a withdrawal, Ron. You don't feel good. And if you have depression, say if you're a man and you have depression, not to mention you're trying to use steroids to feel better, and it actually works because you're in the gym. Like Arnold said, you're playing with the toys in the gym. You're feeling great. Why? And then you come off it. You got a double hit. You're not in your playground anymore like you like.
Yeah.
You appreciate that. And then your brain is now being depleted of not only androgen stimulation, but dopamine, serotonin, norepinephrine. I have all the data. We have all the data on this.
Yeah. I mean, that's a rough place to be. And the
And,
lot,
and Ron, guys kill. I've seen so many suicides. It's
yeah,
sad, Ron.
you've actually lost some patients.
I have. Please, guys, be very careful. Go reach out, come in, go to a doctor, go back on testosterone. Jesus, man, save your life. It's not the end of the world if you have to live on testosterone. Let's just live a long life and not have a heart attack.
The last category seems kind of ironic. Musculoskeletal problems. You think steroids are great for your musculoskeletal system?
It's not true, Ron.
Hmm.
Some guys, you see guys that if we ever bring an orthopedic surgeon on the show, they're going to tell you a veteran, a very good experienced orthopedic surgeon, he's going to tell you 100%. When I see guys that are young, under 35 or so, that have these bicep tears from training, they're all steroid related.
Yeah. Well, let me ask you this. This is my theory. I think I've read it before, so it's not like I came up with it, but steroids increase the muscle mass and strength at a far greater rate than the connective tissues can keep up. So
we don't know.
You can build up a chest this thick, but your tendons didn't have time to grow at the same time. So that's why they're tearing pecs left and right.
So here's the deal. Guys, you're right. That's it. So how does that work? Like, why is there disproportional? The muscle belly grows, so that's muscle belly. The tendon attachment literally can't grow.
Right.
It's not. It's isn't it amazing that the muscle transitions into a tendon?
Mm.
So I talked to the orthopedic surgeons years ago about this, and they're like, Tom, we have no idea. It's got to be common sense. There's deterioration of the proteinuric, the osteocytes and osteoblasts, and blah 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 blah. Who cares? Who knows? Your muscles get so goddamn strong that the link to the bone it's a lever arm, right?
Yeah.
You're benching, you're abducting, your biceps, it's a hinge. So the attachment is you're putting increased forces on it because you're benching, 100 more pounds. At what point is that thing gonna release, tear, or swell, or tendinopathy, and that's it. Now, so slow, steady gains, guys can do it. Guys who have big attachments to the bone, they're just strong, incredible athletes that are just built like brick shit house. Come on, like brick. It's true. I've talked to surgeons, and when they tear something, finally, when they're getting older and they're just benching 700 or whatever, they go in there and look at the attachment. It's just unbelievable.
Yeah,
it's unbelievable. So
it catches up with you because over the past 5 years, I've probably had more little, minor muscle tears, like my quads. I've probably torn my quads 6 or 8 times in the last 5 or 6 years. Minor tears.
Wow.
Yeah, because they got very big and strong over the course of many years, but I think it's all catching up to me now. I'm afraid to use more than 315 in the squat because anytime I do, I'm strong enough to do it, but the tendons, the ligaments, something is not. It's just not cutting it anymore inside. Mm.
So yeah. So what can we do about that, real quick? I don't know. Everyone talks about so many things. I wish we really had something like the chondroitin sulfate, for the tendons. I don't know. I mean, there's that. There's antioxidants. Because if you look at your age, at our age, you're younger than me, my younger brother.
Yeah.
So you're behind me by about 5 years. So it's like, it's just the aging process. So what do we do about that? I mean, are stem cells going to work? Are free radical scavengers going to work? I mean, we're looking at all. Metformin, is all this stuff going to work? Statins definitely could be. I mean, but you don't want to have a heart attack. I mean, but I still use them. I use them offset. I have some secrets. I use them differently when I give it to my patients, depending on what we decide. I work with cardiology guys, but I'm trying to broker between not having a heart attack, not starving myself, and training hard, right, Ron? I mean,
Yeah, yeah. I mean, it's a balancing act. Nothing is clear cut, unfortunately.
no.
You have to take a risk here to get a benefit there. It seems like. Let's talk about the chronic, the long-term effects, and most of these are inevitable. These are going to happen to you if you use steroids long enough. You're going to deal with these. The first one is, did you come up with that term ASIH? Did you coin that term? I'm
No,
curious.
no, no. But I'm definitely one of the first guys, 10 years ago to be really seeing it and clinically working with it. Anabolic steroid induced hypogonadism.
So yeah,
Yeah.
that's it. You're going to lose your ability to produce testosterone. It's going to happen to
Oh,
everyone. It happened to me. It
you,
happened
oh, you
every
agree.
guy I know my age who's a user. It's happened to them.
Isn't that incredible? 100%.
100%. And you're going to have to be on TRT forever. You know, I guess if that's cool with you. I mean, I look at it as, I'd rather not have to do it forever, but oh well, what am I going to do about it now?
See,
So
Ron, when you tell this to like the virgins that come in, when I go, remember the head, I go from the head down, right? And
yeah.
then one of the first things is the CNS, and I say, hey, man, you're going to welcome to the club sooner or later. And, men, virgin young men that are like, they think they can go on, and the anti-aging guys tell them they can just go pump up and go on and off.
Yeah.
And they go, really? I go, you're never going to come off. And they go, never? And I
Right.
go, never. There's Ron Harris. You agree with me? So that
Right.
these are like idioms. These are like rules that are like universal laws. They're never so really, yeah, that's how it goes. Stand up, shake the hand, and walk out.
Persistent elevation of sex hormone binding globulin and estradiol.
So I'm doing a video on this. I'm trying to put it together. Obviously, I probably do it next week. I mean, oh my God, we're so overloaded. I'm gonna put a blockbuster together on this, Ron. I'm gonna blow your
Hmm.
socks off with this one.
That might be a whole episode then. Let's move
Yeah.
on. Heart disease. That is definitely the one most people should be very concerned with because without your heart functioning properly, you're done. You're dead. So
So we don't know.
blockage, left ventricular
So
hypertrophy.
there you go, Ron. You're well educated. So here's the deal. Common sense is common sense. People die from heart disease from three medical reasons: blood pressure, cholesterol abnormalities, which is too much of the bad, too little of the good, and then there's diabetes in there. So hold diabetes out because most men that are using steroids are hopefully in pretty decent shape, and that's why they're using them. And they're usually not type 2 diabetics. But two other things that happen from steroid use that it's widely supported with clinical documentation now, Dr. T knows all this stuff, is hypertension and dyslipidemia. So you're on steroids, old school. I just saw a guy today, Tastin Deca. His HDL went a lot lower, and his LDL stayed about the same. Funny enough, but some guys, but the lowering that HDL, that's not good, guys. And if you have a natural low HDL anyway,
Yeah.
that's the HDL is the algae eater in the tank. If you get a tank, a fish tank, and you can throw some algae eaters in there, well, how does the tank looks pretty good,
Yeah.
right?
Those little sucker fish. Yeah.
Yes, algae eaters. So, but this I came up with this, a couple of years ago. Doc, that's really I can understand that. How does HDL work? So HDL attaches to LDL, and it pulls the whole complex out of the system, so it doesn't end up getting into your arteries.
Well,
So
that's good. I never understood the whole
there you
thing
go.
until the, the algae eater fish analogy worked for me.
We know you love this stuff.
Right.
So no one's going to argue. HDL, women, there's about 10 reasons probably why women have heart disease, not early like we do, and we don't fully understand it. But if you look at the average woman, her HDL is really big, robust, and it's up there and it's healthy. And it doesn't really go down in her until she's older, like postmenopausally. Even then, it doesn't always go down so much, but that's part of it why they get older and they have heart disease. The average bear that comes into me, his HDL is like barely over 40. Even guys off steroids, off anything, eating a good diet, their HDLs are low. Why? They're just men.
Mm,
A very large percent of men have equal or low to 40, and that's bad. Now put it on steroids.
mm.
Every HDL is going to go down, even testosterone. This is why that's testosterone studies are so important to me. Those real legitimate studies that they're controversial now
Yeah.
because they didn't show that the scientific evidence that they can hurt the heart, but we don't know. But if you take something that causes hypertension and low HDL right there, is that going to be good for you, sir, or bad for you? I mean, if you're going to get older, come on, Ron, it's common sense. If you go to McDonald's and you eat food every day, what's going to happen? You're going to get, with all the sodium and fat, you're going to get hypertensive and your HDL is going to go down. That you probably will end up having a heart attack. I mean, do I have to? Isn't it common sense to me, Ron? But
Now we have the analogy that steroids are like eating McDonald's every day. I'm gonna steal that too.
Ron, I'm so I love you, Ron. You know I love you. I love you doing this.
So the blockage is that's a direct correlation to the cholesterol, the dyslipidemia,
No,
right?
Ron, no.
No?
Yes,
Oh,
yes.
oh,
Excuse, no, yes, it
oh,
is.
good.
But it's not just cholesterol theory. It's not the cholesterol theory. I hope we got a lot of hate mail on this and love, and because more hate we get, more attention we get. I don't want the hate. We should have all love. The truth is this: it's multifactorial.
Mm,
There's multiple coronary artery disease. It's not one thing. It's not even three things. It's not. It's probably 10 things.
yeah.
Man, genetics, smoking, bad blood pressure, cholesterol, diabetes, and then you can all the douchebag. You could go into all the little, the not taking enough collagen fiber. All the useless things that are just like snake oil sales. Not enough fish oil from blah blah blah.
Right.
It's. I mean, you gotta love me. I mean, this is the heart. Number one cause of death in this country is heart disease
Yeah.
for men and women. So steroids, goddamn, accelerates that for a lot of men. Not every single one, you clown. But for a lot, they do. Look at my practice. There's a freaking waiting list now.
Yeah. So if you're in a position, if you're using steroids chronically for many years, abusing them, let's say, you might have the same level of heart disease at age 40 that you would have had maybe at 70 or 75.
100, excellent, well stated.
Mm.
It can potentially accelerate atherosclerosis.
Mm.
And
Kidney disease.
and,
I'm
and the
sorry.
left ventricle and the left ventricle, Ron. You hit that before, and that's early heart disease. That's early left ventricle disease, and that's heart failure. We're done. Let's keep moving on.
Okay.
Bad.
Kidney disease, because
Woo.
hypertension is a major risk factor for kidney disease, correct?
What else, though, Ron? Come on, focal
Uh,
segmental FSGS, especially if you're African American gentleman. So FSGS, if you have the genes and those genes are sleeping, you could wake them up. Too much protein. And what's the last piece, Ron? Last piece.
I was going
What
to say diuretics, but no.
close? No, that's in there too, but that's kind of more esoteric.
Mm.
So the average guy who's like just a lift him up, put it down power lifter on steroids who can get kidney disease, he's not using diuretics. He doesn't give a crap.
All right.
So non-steroidal anti-inflammatory agents.
I never think of them because I don't use them. I
Yeah.
probably use Tylenol. I use them once a year, if that.
Here's the perfect storm for the kidney disease, and I have so many of these guys. I can't even. I have dozens and dozens of these guys, and I'm working with Columbia University. I'm pipelining Dr. Bombach, and I could say all these names because these are doctors. You can go see them. Dr. Andrew Bombach is a board-certified nephrologist at Columbia University. He has been referred to me from Leal Hurlitz, who is one of the top. She is the chief of renal pathology at Cleveland Clinic. She's a friend of mine, and she did a study in 2009. Remember that study about steroid users and early progressive kidney failure?
Mm.
And she compared them to people that have obesity can get, and she did a landmark study, New York Times and everything else, 2009. So Bombach is still in working on some of this, and I sent him whenever I see a guy coming in, and I'm so happy to say I have some men that have come in early stages and we're preventing the kidney demise.
Mm.
But
Wow.
most guys come in, they're peeing protein, they're hypertensive, they already have significant kidney disease already, and then we just have to plug the dike. We're just holding them from going to dialysis.
Mm.
And then I have men that are on dialysis, men that are headed to dialysis. I have guys that are going for their second kidney transplants now.
Wow. Okay. Fertility is. Do you see men in your practice who even though, you've talked many times on the show about using HCG to restore their fertility so they can get their wife pregnant or whatnot. Have you come into contact with patients who there's just no hope? They never get their fertility
Very
back?
only out of thousands I've seen, very rare. And
Okay.
those were men. Here's what they are. They're men that had the ones that I've seen were men that testicular cancer and they've removed a testicle. So they're
Okay.
down to one testicle. And then they've done steroids for years. And then I've tried to rescue them with I will never use Clomid ever again, but the urology guys did Clomid in addition to HCG, and they did semen analysis, and the guy never increased. And then I give all the secrets away. The next one is Brevell and Ovidril, which are recombinantly produced fertility drugs that are expensive, more expensive than HCG for LH and FSH analogs, and they will work better. The men that I worked with, they didn't want to spend them. They didn't have the insurance. I think that would cover it. They didn't want to wait, and they just said, "Doc, after a year, I gave some of these men up to a year, and this is all under guidance of urologists. I don't work alone. I'm not a cowboy. I'm a testosteronologist.
That's
I
right.
run the show. So I coordinate care for these men. But when I have men that I can't get fertile after, say, 6 months, I start working with fertility urologists all over the world. And then I've already done the heavy lifting. I've already given up to 3,000. Dr. Lipschultz at Baylor recommends 3,000 IUs every other day to get a young man fertile off steroids. Good job, doctor. I agree with him. That's I start off with 1,500, 2,000, and I usually nail it around 2,500. Guys get fertile. They go back on testosterone once she's in the second trimester. Everything's great. They get another kid a year later. I have dozens, hundreds of children that I've seen produce this way. HCG. I mean, Ronnie has 9 kids, they told me. I mean,
Oh, I think it's more than that.
HCG, no one needs HMG. And there's an argument that you can't even really get HMG. Only the fertility guys can. And you don't need HMG. All these bro science guys love all this stuff. And it's not that it's bullshit, but HMG is a better analog for FSH. So more for increasing the semen. And now, great, love it. There's no true studies on this. They're not some small ones. HCG works for 98% of men, and it just depends the dose and how long the guy's ready to suck it up and suffer to stay off it. Just you can't really do it on testosterone.
Damn it.
But you can. But guys do it. Young guys blast HCG I did it on HCG and I got fertile. Okay, you're 32 years old. You're 28. You blasted HCG at the end of your cycle, in the beginning of your cycle. Of course, you're going to produce some more sperm, and you got someone pregnant. Great. It's humanity. It's humankind.
Now, these patients of yours that were able to get produce children, doctor, the ones that had male children, what percentage of the male children did they name Thomas?
So funny, Ron, because I had some guys that did do, and I'm like, oh my God, please,
Don't do that, please.
don't do that, please don't do that.
It's a big
But
responsibility.
but some guys I mean, it seems like it's so amazing feat. It's just HCG. It works like a charm.
Yeah.
But you have to go into and please do not listen to anyone telling you if you're doing Clomid by itself, if you're a significant steroid user, because it will work on paper, but it could cause pretty severe depression, and men just don't feel good. So I'm just trying to warn the world. None of this is this is all educational. Everything's disclaimer. This is not medical advice, but be careful with that, though.
You always say, "I'm not your doctor, sir."
I'm not your doctor, sir.
Yeah, that's true.
Talk
Okay, well, I'm going to wrap it up because I got to try to get a hold of Ronnie Coleman, one of our favorite people in the world. What do you call it? Look what he named his book.
Yeah, buddy.
What else would he call it?
Unbelievable. How's Ronnie doing?
He's doing great. He had the book. He had a big booth basically to promote the book instead of his supplement line. And then every time I walked by there was a good line of 30 to 50 people waiting to get their book signed.
Yeah.
You know what I made him sign my book? To Ron, my very best friend and training partner.
I love it.
He didn't even blink. He's like, okay, whatever.
That is, that's the king right there, everyone.
He's a good guy, man. I want to remind everyone to get your book one more time, America on Steroids, A Time to Heal. This is a good primer, people. Very basic education you should give yourself before you start the plunge. Take the plunge. You can get that on metabolicdoc.com, anabolicdoc.com, or good old amazon.com. Doctor, thank you for taking the time. I know you're incredibly busy, especially when you're in Fort Lauderdale. I know it's appointment after appointment. It's packed, but you made the time, and appreciate it so much.
The last guy that was in here, I go, sir, I just gotta go. He goes, I know you have the show with Ron, and I was just
wow. He's like, my medical needs don't matter. You guys got to do your show.
Thank you, Ron. Thank you, Steve Blackman. Thank you, the editorial team. Everything. It's just we're on 10 years though, Ron. This is 10 years. Me as the Anabolic Doc with you guys.
Does time fly? Oof.
10 years, Ron.
Wow. It seems like it really does seem like yesterday.
It's just nuts, man. But thank you so much, Ron.
Thank you. All right, guys. Thanks for watching Ask the Anabolic Doc. Tune in next time.
Yeah, buddy.